I was really concerned at first of bringing the virus home, being concerned about it being on my clothes, and being in contact by, hugging my grandkids, my kids.
Well, the one thing that really pulled me out of the depths of despair and fear and anxiety was the community support surrounding healthcare workers and thank you notes written by patients and friends, just to see that so many people in the community were supporting us and wanted us to be safe and wanted us to be able to take care of patients.
These people are in very, very huge amounts of pain and distress, and they get zero visitors. We help patients who haven't been able to communicate vocally for weeks. So when we can provide them with some sort of pleasure, that makes our job and that makes coming to this work environment worth it.
I love my job. I love my job. I want to work here forever. It's a great field. Emergency medicine is a wonderful specialty. I love working at Denver Health. I love all of our nurses and techs and working with the residents.
The early days were pretty scary. I was in Arizona when it first started happening out here, and I was at a concert, and it was probably the last concert before everything got shut down.
Cuando todo comenzó estaba nerviosa, tenía miedo por mí, por mi familia, pero ya poco a poco cuando fuimos trabajando, todo fue calmando.
As a father, it's been really hard to watch my kids lose, school and all of their usual activities. As a husband, difficult to watch my wife have to lose the things that she loves, and even with her work, she's a surgeon, and not be able to practice in the way that she usually does. But then as a physician, it's been particularly difficult, not just because it's hard to come to work and realize that patients are dying and patients are being exposed to something that is new and difficult for us to deal with as physicians.
My patients. I love taking care of moms and babies. I love my job. I love what I do. I like to provide that care whether they're COVID positive or not. I still love to take care of my babies, my mamas, and that's why I come to work every day.
It teeters. Every day's different. You never know what to expect, which is definitely keeps things interesting. We do tunnels for patients who have gone through the ringer, and what I mean by the ringer is they've gone through all 9 yards of COVID, they've gotten sick, they've gotten intubated, their families weren't able to see them at their worst, they were stuck here alone, and when they like to watch them get better, a bunch of people come out and clap when the first time they get to see their families again, and that is one of the coolest things to experience.
Anything can happen to me. I can get some sickness,
At first it was really stressful because no one knew what to do about PPE and people were still figuring that out. Do you go in there with a surgical mask? What counts as an aerosolizing procedure?
Through this whole emergency, I have not heard an emergency physician or emergency nurse or an emergency tech or a paramedic say, I'm not going to come to work because I'm afraid of COVID. I love my job and I'll always keep coming to work. We are experts in the care of critically ill and injured people. If we weren't here, there'd be nobody for these patients, and we're going to keep coming to work and we'll always be here for you.
So I had a patient who was on the ventilator for over a month, and I found out that all he wanted when he got off the ventilator was a grape Powerade. So I kept being like, hey, if you get off this ventilator, I'll buy you a Powerade, and he finally did. And it's just like you realize it's the small things like that that make the biggest difference.
I want to say to every housekeeping or every employee, open your heart and do for the patient. Because the more you do for somebody, the more people also do for you.
So initially I was scared of my wife or my loved ones, my family, getting it from me. So essentially passing it on to others was what scared me the most.
Me siento bien. Al principio era estresante porque todos estábamos nuevos con lo que estaba pasando, pero conforme pasaron los días fuimos viendo más, sentirnos más seguros de que haciendo nuestro trabajo como debe de ser.
There's a lot of sacrifice that we don't like to talk about because we don't want to diminish the stressors that our patients are going through, but it has been a stressful time to be a nurse for sure, and the stigma around it with people knowing you're a nurse and they're less likely that they don't want to see you because they know you're more exposed.
A significant fear and anxiety on the part of all physicians right now is knowing that we can do our jobs and provide the care that we want to provide, and not being able to take care of people the way we want to, or perhaps have to see people suffer and die because of it. That's the next thing that's keeping me up at night.
I love working in the COVID area because that gives me the opportunity to tell the persons, okay, I had it and I made it, so you can make it too. So get out of that bed and you can go home.
I love what I do. I love the decisions that I get to make. I love the people I get to work with. I chose this profession because I wanted to be on the front line of doing this stuff, and you know, there's nothing else I want to do.